Here with us now in our newsroom, we have Dr. Christopher Doring. Always great to see his face on News 8. Okay, we're talking about the Lambda variant. We've heard a lot of stuff about the Delta variant, and it's just very confusing for people. So I wanted to get a little bit of a Q&A in here. Could you explain what we know so far about this Lambda variant?
Yeah, so the Lambda variant, so-called Lambda variant, used to be called the Andean variant, I believe, because it originated down in Peru, near the Andean region, is just another variant of coronavirus, the COVID-19 virus, and it does have slightly different properties than some of the predecessors have had. So those properties seem to make it more contagious, like what we're seeing with the Delta variant, and there may be some, risk that those who are vaccinated don't have the same level of protection, but that's still really being teased out. We don't fully understand that aspect of it at this point.
Okay, and then so you just mentioned that the vaccines are protective against this. We haven't had any data that breakthrough cases, although that I guess we were talking about the Delta variant before, that people who have been vaccinated can then get infected with the Delta variant, but we haven't seen this and spread it, but we haven't seen this with the Lambda just yet. So it seems as if it's not really on the top of the list of variants of concern, or maybe
not.
Yeah,
and part of the issue too is because it has been more prevalent in other parts of the country, they may not be using the same vaccines we're using here in the United States, or that are most prevalent here in the United States. So it's a little premature at this point to speculate on how effective our vaccines are going to be against this particular variant. And that partially explains why you see the World Health Organization come out and characterize this, as a variant of concern, if you will, versus the CDC, who maybe hasn't weighed in on that at this point, because we just don't have enough information to make that judgment.
Right. I guess sort of other parts of the world aren't using vaccinations in the same way. They'd have other ways of controlling it in different countries, and other vaccines that they might be using. So the World Health Organization, from what I understand, is calling it a variant of interest because of this sort of looking at it globally.
Yeah, I think that's exactly right. And again, with varying rates of vaccination in other countries, with different formulations of the vaccine, targeting maybe slightly different parts of the virus, this Lambda variant may prove to be, more able to break through vaccination status in some parts of the world than others. At this point, we don't see it being a major concern here in the United States, but to a certain extent, that's yet to be seen.
Right, we have to keep paying attention and get that data, and I don't know, it's part of life, things change sometimes, right?
Well, and I think what it speaks to is, we are going to continue seeing different variants, and the way these viruses evolve over time is there's certain selectivity for being perhaps more contagious, more lethal. Those are properties that allow the virus to increase and spread, and so there's some selection that goes on when the variants do more, morph and evolve in a way that can make them more lethal, more concerning. And that's not unlike what we see with influenza. Sometimes we will have targeted the right strain of influenza, but then it changes slightly, and the vaccine for flu isn't quite as effective as we thought it was going to be. So
that's great information to get out there, and people are going to appreciate, as always, your insight. Dr. Doring, thank you so much.
Sure, Mary, it's good to be with you. Happy to help anytime.